I'm Rodger Shortt. I'm a plastic surgeon in Oakville. We do a lot of different plastic surgery here. I do reconstructive surgery, a lot of cosmetic surgery. We provide different care for patients depending on what their needs are. I love being a plastic surgeon. I get to help people. I get to meet different people all the time. There's a variety in what I do. One of the things I really love as well is that, it's the patient and I that come up with the plan. And although I'm the one doing the surgery, I'm trying to do a surgery that matches what they want. I don't believe in telling them this is what you need. I think I listen to what they tell me. I listen to what their concerns are, what they're hoping to get. I use my experience to examine them and help them come up with a plan that's going to reach those goals, to make them happy.
I send my family to Rodger. I have that kind of trust in him. And I think he treats everybody with that kind of care, if you will. When I see that, not only in a person, but in a physician, I have no hesitation in sending someone to that person. My mother's been here. She can't stop talking about her experience here. She loves her look. I think that in the future, she's going to want to come back. And it's just because of that interaction. It's just because of how she felt. His colleagues will say, yeah, Rodger, when you see his patients, they look fantastic. But at the same time, it's hard to know that they had anything done.
I don't think I could do what I do alone. I have really great staff that work with me who provide answers to patients, who provide comfort to patients. Sometimes patients feel more comfortable talking to them about things than they may me, and I don't think that I could do the job I do without such great staff.
I've worked with Dr. Shortt for 2.5 years now. The environment here is very warm and comfortable for patients to come to. I find it's much easier to talk to patients once you've actually gone through the procedure. You really know what to expect, and you can sort of guide them and ease them into knowing what to expect as well with the procedure and afterwards as well. I decided 2 years ago that I'd like to consider doing a procedure here. The process was very easy. Dr. Shortt was so kind and so gentle, and in terms of making sure I was comfortable with my decision of what I wanted to have done, my expectations of what I wanted to look like afterwards, it was a very easy process. The light bulb does go off for a lot of patients, and some patients even cried just after their first consultation because they said, finally, I found the person, and Dr. Shortt is the person to help me.
They call it the practice of medicine for a reason. Like, you don't graduate and stop your learning. It's an ongoing process, and we're hopefully always getting better.
He's got to know the new technologies, and he always brings that back, and I think that's what kind of speaks volumes about him, is that it's never quite enough. We always have to be ahead of the game, or at least right at the top of the game, and I think that's who I want. If it's going to come down to operating on me, that's who I want.
I definitely take what I do for granted a lot, and it's patients that remind me of how big a difference I make in their lives. For me, it's always a goal to make them comfortable, to provide them a really nice looking result, but when you talk to them and they tell you what a difference it made to their self-esteem, to their relationship with their spouse, or the comfort in being around their spouse, or they cry because they're so happy, it really brings it home to me that what I do isn't just about changing somebody's physical appearance. It makes a big difference to all aspects of their life.